Hey everyone, this is Megan.
And Darla. We are your hosts of the Enlighten Benefits podcast.
Our goal is to help you understand all things insurance. In each episode, we will tackle the confusing topics and terminology as it relates to insurance.
We want to create confidence over confusion and make insurance suck less.
We hope you enjoy our show. Okay, so let's talk a little bit about, let's do a quick rundown of Medicare supplement plans, and then let's dive right into Advantage plans. Because on our other episode, we talked a lot about supplements. So again, just to recap, we've got Medicare Part A, which is your hospitalization. We're talking about getting old here, right?
Yes.
So we got, when you turn 65, Part A is going to be your hospitalization. Part B is going to be your doctor's visits. And then from there, you have a choice. Right? You can make a choice between Medicare Supplements or Advantage. And on one of our other podcast episodes, we talked about the reasons people like Medicare Supplements is you don't have a network. The insurance company is not in charge. Medicare is still in charge. It also works in any state. You don't need referrals. So that's very comparable to a PPO plan if you're coming from the work environment.
Yeah, I think sometimes it's really good to use examples from the work environment because that's what they're used to.
Most people, yeah.
So you can, if you dug in, technically, like we said earlier, it's a completely different beast, but just for explaining purposes, you can use the words PPO and HMO, but definitely your supplements are complete freedom, just freedom from anyone telling you where you can go and what you can do.
And I think it's also fair for us to give the downside to it too also. So like the downside that I hear for Medicare supplements is it is more expensive, right? And I think on one of our previous episodes, you had said you get what you pay for, right? So I do find that Medicare supplements are going to be more expensive than an Advantage plan.
Absolutely. And if it's a budget issue,
sure.
For you, then this supplement may not be the way to go. But another little phrase that I say is pay now or pay later.
Right.
So you can always tell, or I tell my clients, you may pay a little bit more per month here, but when something happens, you'll have hardly any out of pocket.
Right. You're paying as you go versus paying in one lump sum when you have to have that knee replaced.
Exactly. Right. So on an Advantage plan, you may get the cheaper $29 a month premium, but you're looking at probably a $3,500 to $4,000 deductible.
Sure.
So you're going to pay, right? We live in a world that nothing's free. Never has been, never will be. And so it's just, when do you want to pay and who do you want to pay? Do you want to pay the insurance company?
Right.
And transfer that risk?
Right.
Or do you want to pay the doctors and hospitals, and let an insurance company, be in charge? And then also you're going to pay that insurance company whenever something happens.
So, we've talked about when do you sign up. And so for the Medicare supplement, I always tell my clients, if you think that you might want a supplemental plan, you should go ahead and start that way, because we never know when our line of insurability is going to be crossed. Meaning you can go to bed tonight and be 100% completely insurable, have chest pains, wake up tomorrow, and you may not be able to answer the proper medical questions in order to get a supplement. So the thing about the difference between Medicare Advantage and supplement is you can always go from a Medicare supplement plan during the enrollment periods. You can always go from a supplemental plan to an Advantage plan, but you cannot go from an Advantage plan over to a supplement plan without answering medical questions.
Very true.
Right?
Very true.
So a couple of highlights for an Advantage plan is Medicare is no longer primary. The insurance company becomes the primary. you do have to declare who your primary care physician is. It's going to be listed on your card, and that's who you're going to need to start with whenever you are seeking a treatment plan for whatever's going on with you personally. You also have a network that you must stay within. So we are recording this podcast in Oklahoma. Darla and I are based in Oklahoma. So if one of our clients, enrolled in an Advantage plan here with us, you must stick with the hospitals here in Oklahoma. So we like to say it doesn't afford you the opportunity to have coverage outside of your state. Now, that's not 100% true. I mean, any insurance is going to cover you if it's of life or limb, right? But you do have to be in constant contact with your insurance company. If you are having a vacation in Maryland and something happens, you do need to contact your insurance company. I would say that the biggest advantage plans here in Oklahoma are probably going to be community care and AARP.
Humana's in there too.
That's true.
Yeah.
Yep, Humana. But community care is the biggest here in the state of Oklahoma, specifically Tulsa, because it covers your saints, right?
Yep.
It covers St. John and St. Francis. And those are our two biggest hospital providers within the Tulsa metro area.
Yes, I would agree. And then, if you move, because we get that a lot, because people will have, maybe a lake house or something. And so if you move, then you have like 63 days or some amount of time to find you've moved to a whole new state, and you have a certain amount of time to find out what their major hospitals are. Right. That would be a kind of a weird thing, because it's like we've grown up here in Oklahoma, so we know that St. John, St. Francis is like kind of top of the line, I guess. I mean, nothing against Hillcrest, Southcrest, but it's like you go to another state and you just have a short window to get opinions from people in that state.
Hopefully you've got good friends.
Yeah, hopefully you have really good friends to go, what hospital do I want? Right. I mean, I have no idea.
Well, and I think it's also important, I have clients who have, I've actually worked with them on the Advantage side, specifically for Humana, because their specific condition, their doctors are all affiliated with Hillcrest. And so, community care wouldn't be a good option for them. So it really is not just what's the most popular, hospital, or like what's the most, I guess, well-known in that area, but it's also like per your specific condition.
True, because specialists are a big part of healthcare. Right. And you get in with the right cardiologist or ear, nose, and throat, or, whatever it is, really your primary cares are only going to deal with colds and flu. Right. But if you get into something really special that your loved one is going through, then my personal opinion, I would not want my hands tied. Yeah. I would want to be able to reach out and get the best provider I could get. Sure.
The reason so we've kind of talked about the reason that people steer away from Advantage plans, right? You're very limited. Mm-hmm. You're told, who you can and cannot see. You're told what hospitals you can and cannot go to. And you are also at their mercy whenever it comes to needing that surgery. And you and I both have a mutual client and loved one that recently had a negative experience on the Advantage plan. He was needing to have a surgery done, and it had to go through the insurance company. And it was a simple abdominal hernia, and it took 3 months to have that approved, which we all have horror stories. Again, it's not negative upon the Advantage plan, but I do feel that if the individual would have been on a supplemental plan, things could have happened a lot more quickly.
Oh, I totally agree. Let's just talk about COVID. I mean, the pandemic caused huge awareness on network. I'm the same way. I had a client who was needing something done during COVID, went to the emergency room, and they were told that within their network, all the beds were full. So they were going to lifeline him to Ardmore or something. Yeah. And if he would have been on a supplement, it would have been, okay, well, don't just check St. John, St. Francis. Let's check Hillcrest, Southcrest, Osh.
Right. Any hospital.
Exactly.
Right.
So the COVID thing really opened my eyes to the limitations of how our patients' care, is handled during that. So
those are the downsides. The positives, and the reason that I do assist people with getting on Advantage plans is the cost. If monthly budget is a concern of yours, the Advantage plans do have zero premiums. With that zero premium, you are going to receive a higher maximum out of pocket. So if something happens, you are going to have to pay $3,000, $4,000, $5,000 for that occurrence. But month over month, you are not going to have that expense that we've talked about on previous episodes, with the supplements that are, $100, $125, $150. So if budget is a concern, then Advantage is probably more of a realistic option.
Yeah, I agree. If you are focusing on monthly cost, the one thing that I would really kind of tell people to steer clear of is the zero premium plans. And, the commercials are there where, zero premium, zero copay, we'll come get you for your doctor's appointments. We'll bring you food. We'll pay for.
We'll do your toenails.
Yeah, we'll do your toenails. Whatever. I mean, I would be so leery of someone telling me I get all of that for zero.
Right. And the only time I will say is because I have worked with a fair share of in a previous life when I worked for corporate America. I worked with my fair share of veterans, and there is actually a really good zero premium that I sometimes compare veterans up with, especially if they're getting all of their care from the VA hospital. And they're also getting their medications from the VA. So
I see.
Yeah, there is a great option. Again, I just think that these things are so specialized. I would encourage anyone, of course, I would encourage you to work with us as brokers, but I would encourage anyone who's digging into turning 65, work with a broker, work with someone who knows all the ins and outs of these different plans. If I hadn't had that experience working with veterans historically, I would never have known about or been able to steer my loved ones towards that zero plan. So,
yeah, I mean, there are a lot of scenarios out there, like you said, that are just going to be, you don't want to deal with someone who's going to pigeonhole you or make you fit into a plan because that's all they can offer.
Right.
But I do like what you said about the veterans, because the 99% they can use the VA.
Right.
But there may be that one scenario where they need that special surgery that they could come in and fall back on an Advantage plan.
Absolutely.
So, yeah. I like that. That fits really well together.
The other thing I think it's worth mentioning is there are different options within the Advantage plans. So there are, just for purposes of conversation, there's like a silver plus, gold, platinum. And so that's something that we always sit down and talk to clients about is what fits your budget, what fits your lifestyle. And, to your point earlier, you were saying, gosh, don't pigeonhole yourself into just one product. And again, I'm going to give another plug because it's our podcast and we can plug whoever we want. So
amen.
I'm going to give another plug for brokers. I would encourage anyone to not just call the 1-800 number for an Advantage plan. Talk to a broker and see, is an Advantage plan best for me, or is a supplement plan best for me? Or heaven forbid, is straight Medicare what's best for me? Rarely is that going to be the case, but most of the time I'm not going to encourage someone to just roll the dice on that extra 20%, because we all know that medical procedures are very expensive. And goodness, if you had to pay, you know, just 20% on $200,000, that could very well put someone into medical bankruptcy.
Oh, so hands down.
Be careful with that. But definitely visit with a broker, figure out what's going to be the best for you or your loved one's situation. I would encourage you to call us or any broker that's in your state. The other thing I want to be mindful of is certain brokers do charge, right, for a consultation fee. And I think that that's just important.